thing I do want to say, actually, one most important thing actually I do want to say is to not procrastinate. Year 1 you can procrastinate, do whatever. Year 2, don't do it. Don't do it. So yes, shoot me now. Hey guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again back onto my channel. My name is Belinda, and if you've not already subscribed, please don't forget to press the subscribe button as well as turn on the notification bell so you get a notification every time I upload. This is a nursing based channel and a bit of other things as well. So today, as you read from the title of the video, I'm doing a second year update on nursing students, how to pass your second year as a nursing student, as well as sharing with you guys my own personal experience, how I managed to pass year 2 to get into year 3. Okay, so that is what I'm going to be discussing in this video. I've already did a year 1. I'll leave it up here as well down in the description box. So if you're a year 1 student or you are planning to start nursing school, year 1 will just give you a sort of an understanding what it's all about. Obviously, I'm aware that universities vary. However, I'm just discussing with you guys how to pass year 2 to go into year 3, as well as how to pass year 1 going into year 2. Okay, so these are the kind of things I'll be discussing in this very video. So if you are interested in watching, stay tuned. So basically, I just want to start off with saying, obviously, if you've already watched my year 1 nursing student video, you will know that in year 1 I did mental health nursing. Thereafter I transferred over to adult nursing in year 2. So there was a kind of a bit of change, not really major change because assignments were all the same. However, assignments were in relations to your specific field of practice. So in this case, all assignments that were given to me in year 2 were specifically based on adult nursing, as I was an adult nursing student in year 2. And year 1, it was all really generic, if I can say that. We all got the same, obviously, assignments in regards to our field of practice. So I just want to let you guys know about that. So with year 2, guys, I think I said it in my very first video, year 2 was the hardest year out of all the 3 years of nursing. I think I'm not the only one who says this. I think there's quite a lot of students who would agree with me to say that year 2 was quite intense, and it was quite intense in regards to assignments as well as expectations. Now, if you guys remember, in year 1 I did talk about that the marks in year 1 don't specifically count towards your final mark. However, on this hand, year 2 mark does count towards your final mark. So with year 2, you want to actually aim higher, if that makes any sense, in order to excel better. Now, as I was saying, in year 2, obviously, like I said, it varies from university to university. However, I'm just giving you guys sort of a foundation as well as sort of an understanding. Okay, so this video is obviously not going to be too long, because I think the first one was more in depth than this one. So I'm going to talk first about the academic side, and then I'm going to talk about the clinical placement side. So with the academic side, we got 4 assignments in total. And the first assignment that we got obviously was a nursing based evidence assignment. That nursing based evidence assignment was preparing us for the current assignment that we're working on in year 3, which was the dissertation. You had to do a literature review, you had to critique it, and basically it forms sort of the same structure as a dissertation. So in that specific assignment, you had to choose a topic in accordance to your field of practice. Once again, they like to give us these kind of assignments, choose your own topic in regards to your field of practice. However, this is what you need to write about. So you had to find literature articles that you would critique against and also back it up with evidence. I think for me that was one of the hardest assignments that I had to do, because I wasn't really familiar with how to do literature review and how to literally go about it and how to critique it. Although they gave you various study materials that you can follow, but if you've never done that before, it's really hard to do it. And I don't know if I said that before, obviously in year 1 we had lectures that we attended, whereas year 2 we had to adapt to everything being online. So that was a massive transitioning, and it was really hard to adapt of the way of teaching, you know. So next we also had a module also known as complex care needs. So basically with this one, they gave us a case study of a patient in a hospital, and basically it was us analyzing it, okay, what diagnosis the patient has, how to treat it. So basically it was a case study which was more in depth. Now I remember, I think I said in year 1 we also did a case study. However, the case study in year 1 was less complex. Now when I say less complex, they didn't need you to do as much research and use your logical thinking, and the logical thinking is what you would have obtained from your placement, clinical placement. And to be honest with you, I think had I have not been in year 2 and I didn't learn this on the way as I went, I would probably have not been able to answer this question academic level wise. Now I just want to remind you guys, you know, obviously in year 1 they need your academics to be on level 4. They have different criteria: level 4, level 5, level 6. Level 6 would be your final year. So if you have a look at your rubric or your criteria, you will realize that in year 2 you have to have a certain level of academics, as well as a certain level of understanding, as well as writing, you know. So the whole point is that every year it needs to progress and improve as the years go on. So the next assignment that we had was contemporary issues in nursing. So anything relevant to the current nursing with chosen module themes. So basically with this module you had to choose a topic and you had to back it up with various models. This was the title of my assignment: ethical dilemmas for nurses providing care to Jehovah's Witnesses who refuse blood transfusion. And in this assignment basically we discussed about the ethical side, we discussed about the advocacy of the patient, right, human rights as a patient, as well as yourself as a healthcare. So like I said, I'm not going to get into details too much with what it was about. And then lastly we had a module that was known as responding to altered health needs. This once again was a case study of a patient that we had to analyze. So it was just really identifying all those gritty bits. It was more like an assessment on the patient. We were given a certain amount of information, and then we had to really assess. Overall with the assignments, like I said, the standard has changed obviously from level 4 to level 5 writing wise. And again, I don't know how other universities work, but I'm sure most universities are the same, that whatever assignment you get is mostly going to be based on your specific field of practice. And yeah, so that's what it's about. So in regards to academics, it was a bit harder this time around because everything was online. However, I don't know, everybody finds it differently. For me, like I said before, year 2 was the hardest. I think that was the most frustrating one of all. And yeah, that's basically what we did for our assignment. Obviously with the pass mark still having to be 40 and above. However, because of this COVID, they did implement the no detriment policy. Now don't ask me what it's about, but when we had a webinar with the lectures in regards to what the policy was about, they explained to us that the policy was to basically keep you on the same level, academic level, that you were in your first year, because obviously the teaching online can result in students' marks actually dropping, so that students who used to get 70, their marks don't go dropping down all the way to 40. However, there was a bit of debate on this no detriment policy because people found that actually their marks were decreasing. I don't know how it works. That was my average in year 2, whereas in year 1 it was between 70 up to 78 as my highest. So that's what it has been before. I'm not too sure now, being in year 3, how it's like, because we still are waiting certain results. So I will judge it when I see it. When you write your academic, try and get someone obviously to proofread it. Make reference to literature articles. Lectures like references to literature articles. You know, it kind of shows off that you actually know what you're doing, even though you don't. But make reference to relevant literature articles, up-to-date literature articles, okay? Anything within the last 5 years. And if you're like me and you study independently, I don't have a study buddy. I've never had a study buddy for my whole time at uni. I always did everything by myself. One thing I do want to say, actually, one most important thing actually I do want to say is to not procrastinate. Year 1 you can procrastinate, do whatever. Year 2, don't do it. Don't do it, because you will feel the pressure. You will feel like everything is getting too much. Okay, so in regards to clinical placement, so in year 2 I had my clinical placements in a surgical ward. Mine that I've moved over to adult nursing, and then I had my clinical placement in a respiratory ward. So the respiratory was just when COVID. We still got paid for our placements last year. Obviously this year, depending on the hospital that you're going to, certain students are getting paid. However, I know that we are going on clinical placements soon, and we are not getting paid because the county rather said that they won't be paying the nursing students because they don't find that there is a need to pay us. Okay, that's fine. You just have to get on with it. So with my year 2 placements, like I said, obviously there was a higher expectation. Year 2, they expect you to know a certain amount of things that in year 1 you didn't know about. So in year 2 we were supervised, okay? As students, you are supposed to still be supervised by nurses. However, the amount of supervision you get from your year 2 is different to the amount of supervision you get in year 1. So I would say in year 1 you get direct supervision, like supervising the mentor nurses supervising you, whereas in year 2 you get limited amount of supervision. So you have to start thinking on your own head what you have to do, when you have to do it, why you have to do it. Obviously there's certain things that they will still supervise you for example medication rounds. You will still be supervised but limited. I feel like from my personal experience, in year 1 we were supervised with the nurse literally standing over here, okay, like over your shoulder, okay? And then in year 2 the nurses were literally standing like a bit further away. You know, obviously they can still see what you're doing, especially when it comes to medication round. However, they were staying a bit further away from you. So it would be good to know your calculations, you know, your medication. Those are vital things to know. In addition to that, they will be testing your vital signs, how much you know about vital signs. So if your patient's blood pressure is high, what you have to do about it. Why is the patient's blood pressure high? They will try and ask you those. Those are the things that you actually should know. You know, what could be the possible causes of certain things. So you need to be able to think on your feet. What are they expecting from you? In addition, being on a surgical ward was nice, and I think the reason it was nice was because the staff on the ward were nice. They were great, they were amazing. It was really a nice environment to work in. However, I possibly can't see myself working there because it becomes very repetitive, you know. Patient coming in, taking the patient's obs, taking the patient down to theatre, bringing the patient up the minute the patient comes back from theatre, do post-op checks, so on and so forth. So it was nice, but it was not something that I saw myself working in. But it was a great learning experience. Like I said, you know, I think with every ward, whether you enjoy the placement or not, there's always something that you get to take away from it. In regards to my second placement that I had was in a respiratory ward, which was a bit scary because it's a respiratory ward. It was quite a number of COVID patients, so we had to strap up, and that was quite a scary placement. Scary in aspects to you don't know whether you're gonna have it or not. So obviously with that placement we had to do regular testing just to be on the safe side. It was a good placement. My mentor, she was amazing, bless her, and the staff members, they were amazing as well, but I just couldn't see myself working in a respiratory ward. Now the reason being for that is because with a respiratory ward you are really looking at specific things like the patient's oxygen levels. And although you as a person, you know the normal oxygen level of a person, what it's supposed to be, 96 and above. However, because these patients have medical history like COPD, pneumonia, things like that, you know, it was constantly back and forth, back and forth, back and forth. Like I said, I don't like repetition of things. It just messes up with my brain. I like seeing new things all the time, and that is why I decided to do my first job once I qualify in A&E, because that's what I like to do, as well as the learning experience. So, but that's a video for another day. That's basically, we had 2 placements, longer placements obviously than year 1. Year 1 we had 3 placements, but a bit shorter. I think it was like 7, 8, 7, like that. Whereas in year 2 we had like 10 and then 11. So that's what we had. I think it can be a bit annoying if you're gonna be staying in one place for such a long period of time. I think personally, after a while you get bored of certain placements, and then you do want to change, because you already know what you need to know from that placement. In regards to hours on placements, if you rang in sick basically in your year 1, I think year 2 would be the most ideal time to actually try and catch up with your placements. For me personally, I obviously calculated how many hours I've made up in my year 1, and then I calculated how many hours I've made up in my year 2. So I was behind with some hours, but in year 2 I tried to catch up with those hours, which I eventually did. So that was a bonus for me. So if you've only got 2 placements, calculate your hours after your first placement, so you can prepare yourself how many hours you've got to make up in your second placement to get to my, how many hours, 2,300 hours that they want. And also in your second year, you would want to also carry a portfolio. I think I've mentioned it in my first year. I bought myself 3 of these folders, so I've got a portfolio for year 1, year 2, year 3. These portfolios, guys, come in handy in your final year when your personal tutors, academic tutors are requesting for your portfolio, as well as when you go for job interview. There might be a possibility that they ask for your portfolio. At the moment, I don't think that's it, because I had my job interview for a newly qualified registered nurse, and because it was online, I didn't have to show them any portfolio. However, I did still create my portfolios, like I said, because I'm not too sure whether my personal tutor at the university is gonna ask or request for it, because they normally request you to create a portfolio. So yeah, guys, basically that is all I've been doing for my second year. Like I said, second year was the hardest. Once you pass second year, really the rest is just like going really quick. Like I said before, I've literally got 5 more months left before I qualify, and then that's me done. So from the beginning when I started all the way to now, time actually went quite quick. Right, so this is all I have for this video. If you've got any more questions or any videos you want me to do, please don't forget to comment that down below, and I hope you give this video a thumbs up, share it, comment, like and subscribe, and I will hopefully see you guys in my next video. Bye.